Hello everybody, I'm Dr. Ximena Wortsman. I'm a radiologist fully dedicated to dermatologic ultrasound and part of the team who published the Epsom position statement on dermatologic ultrasound. In this presentation, I'm going to share with you the main indications of ultrasound in aesthetics. These are the main indications and we are going to review them one by one. The first one is photoaging. What is photoaging? Photoaging is the presence of clinical and histologic signs of aging in the skin due to the chronic exposure to sun, which is superimposed on the normal aging process. In histology, we detect a deposition of glycosaminoglycans and an abnormal amount of defective elastic fibers, which is called elastosis. These alterations are located in the papillary dermis, which is the upper layer of the dermis. How photoaging looks on ultrasound. If we compare the normal skin on your left and the skin with photoaging signs on your right, you will immediately notice an hypoechoic band in the upper dermis. In this case, this band is marked with asterisks. The band that I'm talking is called SLEV, which is an acronym for Subepidermal Low Echogenicity Band. What is the importance of this band? This band is important because the skin with photoaging signs is more prone to present cutaneous pathologies. We should not confuse the SLEV with inflammatory or tumoral infiltration because the SLEV is only located in the upper dermis of exposed to sun regions. The second indication is the recognition of relevant anatomical data. As you may know, anatomical variants are not infrequent and these may be relevant for performing aesthetic procedures. Among these anatomical variants are a variable distribution of the size and number of the facial and labial arteries. This is important because these vessels should not be damaged during the aesthetic procedures. Other common variants are the variants of the parotid gland. On top you can see in transverse view the parotid gland that presents its body behind the masseter muscle. In the image located in the middle, you will notice a small accessory parotid gland that is separated from the main gland and located on top of the masseter muscle. In the figure located at the bottom, you can see an anterior prolongation of the parotid gland that is covering the masseter muscle. Usually, the variants of the parotid gland follow the axis of the location of the parotid duct. These variants are relevant because they can be damaged during the aesthetic procedures. The third indication is the management of cosmetic fillers. We know that the injection of cosmetic fillers is increasing worldwide. At the same time, the reports of complications of cosmetic procedures are increasing. And as you know, most of these procedures are non-imaging guided. But what are cosmetic fillers? These are nanoparticles that can measure 1 to 100 nanometers in size. They're supposed to be inert materials and they can be classified in biodegradable, such as for example hyaluronic acid, and non-degradable deposits, which are synthetic materials, such as for example silicone, which can be pure silicone or silicone oil, polymethylmethacrylate, polyacrylamide, or calcium hydroxyapatite. These fillers sometimes are called dermal fillers, but dermal fillers is a misnomer because usually the majority of the deposits is located in the subcutaneous tissue. What are the objectives of using ultrasound in cosmetic fillers? The main objectives are the detection, identification, and quantification of cosmetic fillers. Here you can see a summary of the ultrasonographic appearance of cosmetic fillers that are published in the literature. We will review the most common types of fillers during the presentation. But what are the main problems with cosmetic fillers? First, their diagnosis can be late, and these complications can mimic other dermatologic pathologies. Sometimes there is an unclear history of injections of fillers. Sometimes the patients present several cosmetic procedures, and there is an underestimated severity of the complications. At the same time, the patients tend to avoid biopsies because they don't want to have scars. Among the most terrible complications of the injections of cosmetic fillers is blindness. And this is produced by the injection of the supraorbital and supratracheal arteries that are branches of the ophthalmic artery, and the production of a retrograde embolization of the filler in the ophthalmic artery and central retinal artery. This area that is close to the glabella is one of the most risky zones for injections, and of course it is not recommended for injecting filler. Another complication is the presence of epidermal necrosis due to the embolization of dermal and subcutaneous arterial branches. In this case, there was an occlusion of the branches of the alar arteries due to the presence of a granuloma in the subcutaneous tissue that probably caused an alteration of the path of the tip of the needle during the procedure. Notice the areas of hypervascularity of the dermis and subcutaneous tissue in the right part of the figure in comparison with the hypovascularity of the same layers in the rest of the image. Another type of complication is the presence of ecchymosis after the injection of a cosmetic filler, in this case hyaluronic acid. The ecchymosis produces inflammatory dermal and subcutaneous signs, which are characterized by a decreased echogenicity of the dermis and increased echogenicity of the subcutaneous tissue. In the grayscale ultrasound image located on top, you can notice the hyaluronic acid deposits in the subcutis of the lower eyelid that are protruding into the lower fat pad of the orbit. These hyaluronic acids appear as round and oval shaped anechoic structures. In the color Doppler ultrasound image located at the bottom, you can see the increased dermal and subcutaneous vascularity in the periphery of the hyaluronic acid deposits. It is now well documented in the literature that the results of the ultrasound-guided hyaluronidase injections are much better than the blinded injections of hyaluronidases. There are also some delay reactions, and in this case we have a paniculitis of the subcutis after 4 months of injection of hyaluronic acid, and you can see here the increased echogenicity of the subcutis with some thickening and hypoechogenicity of the septa. Also, there is hypervascularity of the subcutis. Another complications is the appearance of granulomas secondary to hyaluronic acid, such as in this case you have here the lumps in the frontal region, and on your right you can see the nodules, the hypoechoic nodules in the subcutis with a mild increase of the vascularity in the periphery of this granulomatous tissue. A different filler is silicone oil, and as you can see, the appearance of silicone oil is hyperechoic and present a diffuse posterior reverberance artifact. Silicone oil appears differently on ultrasound in comparison with pure silicone. Both can be mixed in some areas, such as, for example, in this patient in the cheek, the pure silicone appears as anechoic oval shape, taller than wide deposits. These taller than wide deposits are typical of pure silicone, and they are usually mixed with the silicone oil. When the patient says that she was or he was injected in one area, you should look in the periphery, because, for example, this patient mentioned only she was injected in the lips, but she also presented silicone oil in the cheeks, in the glabellar region, and also in the lymph nodes, in the submandibular lymph nodes. This is another cosmetic filler called Polymethylmethacrylate. The acronym is PMMA. In this case, you are seeing a patient with fistulization of the deposits in their right gluteal region. And notice the appearance of these deposits. They show as hyperechoic areas with mini comet tail artifact. This is another type of cosmetic filler called calcium hydroxyapatite. On the left, you can notice the lump in the peribuccal region, and on the right, you can see the hydroxyapatite because it appears as hyperechoic dermal deposits that produced a posterior acoustic shadowing artifact. This artifact is due to the calcium presence. Today, ultrasound is important for managing the complications of cosmetic fillers, as is well shown in this algorithm that is published in the literature. So the ultrasound report should say if there's any filler, if there's more than one type of filler, what filler we are talking about. We have to identify the filler or the fillers, the anatomical location, if the filler is in the dermis or the hypodermis, if there is involvement of deep structures, for example, if there is presence of fillers in the lymph nodes, in the muscles, or in the glands, the extent of the deposits in all axes, and if you have inflammatory signs in the periphery, and what type of vascularity are we dealing. The fourth indication is the detection of implants and their complications. One of the most used organic implants is fat, and this is called lipofilling, and we have an example here. This is a lipofilling of the lower eyelid, and the fat grafts appear as oval-shaped hypoechoic nodular structures that disrupt the normal echostructures of the superficial layers. In this case, you can see here these hypoechoic, well-defined nodules located in the subcutis and protruding into the intraorbital fat pad. This is a synthetic implant that is made of polyethylene and is used in rhinoplasty. This implant appears as a hyperechoic band that is usually surrounded by a hypoechoic inflammatory or granulomatous material. The fifth indication is the detection of complications of lipolytic procedures. Among the lipolytic procedures is the cryolipolysis. The principle of cryolipolysis is to freeze the fatty tissue in order to generate inflammation and liquefaction of the fat. Notice in the image located on the right the presence of anechoic pseudocystic structures that correspond to the fat liquefaction areas and increased echogenicity of the subcutaneous tissue that correspond to the panniculitis inflammatory areas. Additionally, you can notice a mild hypervascularity in the subcutis due to the inflammatory signs. Another lipolytic procedure is radiofrequency. The principle of radiofrequency is to use heat to generate inflammation and liquefaction of the fatty tissue. In the color Doppler ultrasound image on your right, you can notice the decreased echogenicity of the dermis and increased echogenicity of the subcutaneous tissue, besides the hypervascularity of the dermis and subcutaneous tissue due to the inflammation. The last indication is the detection of complication of surgical aesthetic procedures. Common examples of complications after surgical aesthetic procedures are seromas or seromatomas, as well as inflammatory signs in the subcutaneous tissue. In this case, these alterations are post-liposuction. On your left, you can see a hypoechoic seromatoma in the subcutaneous tissue. Notice the posterior acoustic reinforcement artifact due to the fluid component of the collection. Besides, you see a decreased echogenicity of the dermis and increased echogenicity of the subcutaneous tissue due to the inflammation. On your right, you can notice an increased echogenicity and vascularity of the subcutaneous tissue due to the regional inflammation. In this case, post-abdominoplasty, you see multiple fragments of non-reabsorbed hyperechoic sutures in the subcutaneous tissue, surrounded by hyperechoic inflammatory and granulomatous tissue. Another case, post-abdominoplasty, that shows a cutaneous lesion in the abdominal wall that corresponded to a hypoechoic dermal and subcutaneous fistulous tract. Within this fistulous tract, you can notice some hyperechoic small fragments that corresponded to non-reabsorbed sutures. In conclusion, ultrasound can support the diagnosis and provide critical information for aesthetic procedures. Here you can see my contact information for aesthetic procedures. Here you can see my contact information in case you need to reach me. Thank you.